Let's do some NCLEX practice questions on pneumonia. If you're a nursing student in med-surg class, or you're going to be eventually, you're not going to want to miss this because not only are you going to learn about pneumonia, you're going to learn about how to study pneumonia and how to think like a nurse. So let's get started. If this is your first time doing practice NCLEX questions with me, I use my NCLEX style question AI tutor, which is a chatbot that I programmed myself to use best practices of NCLEX style questions, including making sure they're at the appropriate level of Bloom's taxonomy so that they're going to match what you see on your nursing exams and NCLEX. I told it I want pneumonia for med-surg topics, so let's see. Now, I am purposely not showing you the answer choices. I'll recommend a video at the end where you can learn how to answer NCLEX questions the way I'm teaching you myself, but let's go ahead with this one. A nurse is assessing a client who is admitted with pneumonia. Which assessment finding requires immediate intervention? So first, we're going to ask the one question to rule them all. What do I need to know in order to start thinking about and answering this question? I need to know a little bit about pneumonia. I need to know what kind of assessments might we be doing for somebody with pneumonia and what kind of interventions we might do for pneumonia. So that's a lot of stuff. If you've been studying with my Silver Bullet study system, then you kind of know how all of that information connects and you probably already have ideas. But with pneumonia, we also want to think about normal, which is like, what would normal lung anatomy be like? The pathophysiology of pneumonia is inflammation of the lungs. And as far as that goes, we know we're going to be doing different lung and respiratory assessments, thinking back to our fundamentals class and our health assessments class and how we use our stethoscope to listen to breath sounds, what normal breath sounds are, and things like that. Okay, so we've kind of activated some of the mini concept maps. Now, if there's any of this that you don't know, then you can just do a quick Google of it, to be honest with you. And I'm actually going to model that for you with one of the other questions I have picked out for you today. Let's look at the answer choices now. We're going to treat them like true-false questions as we go through, and we want to look at them individually and see how do they fit with the information we already kind of activated with the question. And so the question is saying, again, just to review, which assessment finding requires immediate intervention? So a temperature of 101 degrees Fahrenheit, that is a fever. So we would have, in order to understand this, we have to remember what normal temperature is, 98.6 degrees. And we also would have to connect to how does that plug into our concept map that we were building here? Well, we know pneumonia is usually an infectious illness, and so our immune system would be activating, and part of the innate immune system is a temperature. So running a fever. So this is kind of expected with pneumonia. So I'm not sure it requires immediate intervention. Although if there's nothing better, if there's nothing more urgent, then this might be something we would address. So we could keep it for now, but I don't feel very strong about it. So now we go to number 2. It says respiratory rate of 32 breaths per minute. Now, what do we need to know in order to understand this? Normal respiratory rate is 12 to 20 breaths per minute. So we could see that this is very high. It's what we call tachypnea, so fast breathing. And so that's something that's of a concern because since we are comparing this to normal, we know if they're breathing faster, that's usually a sign that they're having trouble with getting enough oxygen in the body. And that is something that fits very well with our concept map for pneumonia because pneumonia, is inflammation of the lungs, which means that there's a high likelihood that you're going to have some breathing problems because that's the main job of the lungs. And if the lung's main job is breathing and now something's wrong with the lungs, we can expect that there'll be something wrong with our breathing as well. So this does seem more urgent because breathing is kind of essential. So we're going to keep that one for now and move on. Okay, so third, productive cough with sputum. Here is something else that does fit very well with pneumonia because, again, as part of our immune response to an infection or the inflammation in the lungs, we expect excess mucus to be produced because that's kind of how the garbage gets taken out, okay? And so we would expect the sputum and the yellow colors to be expected. If it's productive, though, that's actually a good sign because if it's productive, it means the garbage is getting taken out. So we're getting that mucus, that sputum out of the lungs. So this is actually a good thing. I'm not sure that this particularly needs any intervention. It's what should be happening. So we could say that's false. That's not going to require immediate assessment for sure. Immediate intervention. So we have the last answer choice is oxygen saturation of 94% on room air. Now, they're on room air. So we know what's the other options? They could be on oxygen. They're not on oxygen right now. It's just room air. They're on 94% oxygen saturation. So this is the pulse ox, part of our vital signs. Now, normally, we'd like it to be at least 95% or higher. And so this is very, very close to 95%, but it is an abnormal result. So this is something that will also require intervention. but does it require immediate intervention? So let's look at the 3 answer options that could potentially require an intervention. That's the 94% on room air, the respiratory rate of 32 breaths per minute, and the temperature of 101 degrees. And I think with the 3 of these, now we can compare and prioritize and say, of the 3 of these that are kind of plausible answer choices, some of them are really good distractors, and one of them is going to be the correct answer. And in this case, put in the chat or put in the comments what you think, what your guess is, and tell me if you got it right. But we're going to go with respiratory rate of 32 breaths per minute because this one is very tachypneic, whereas this one is very close to normal. So, and if we take care of this one, this will probably get taken care of by itself, okay? So sometimes if it's helpful to think of it in a logical manner. Be like, if I fix this thing, what else is that going to fix? And so if we fix this, this is probably going to fix itself. So we might as well take care of this first as the priority intervention and then take care of that. So that's what I had put into the chat when I was doing this in preparation, and it was correct. Now, my chatbot does give rationales for everything because you should be, when you study the way I teach, you should be able to generate a rationale of your own that you understand for every answer choice. And that's what we did. Fever is common, does not require immediate intervention compared to the other options. But we might give them, some ibuprofen later or something, an antipyretic. So let's I'm going to skip forward because the second one was a little bit on the easy side. But then I said, look at this. I made a mistake and I told it to give me a really hard one. And you know what? It gave me a select all that apply question. I hate them just as much as you do. But they don't freak me out because we have a strategy. We approach them the same exact way we did the other one. So this question is, a nurse is developing a care plan for a client with community-acquired pneumonia. Which of the following interventions should the nurse include to help improve the client's oxygenation? Select all that apply. So with this one, we would need to know what community-acquired pneumonia is and maybe how that differs from regular pneumonia. It doesn't, spoiler alert. The difference between community-acquired is compared to hospital-acquired pneumonia. Hospital-acquired pneumonia is usually more serious. It might be with a bacteria that's more difficult to get rid of, whereas community-acquired tends to be less severe. Okay, and then which of the following interventions should the nurse include to help improve the client's oxygenation? So we're thinking about oxygenation, so I want to think about all the things that have to do with normal oxygenation, like the lungs, respiration, circulation, things like that. Specifically, how they tie and relate to pneumonia, and understanding that this is a community-acquired, so it's probably not quite as acute as something that was hospital-acquired. So let's look at the first answer choice. It says, encourage the client to perform incentive spirometry every hour while awake. Well, that sounds pretty good because incentive spirometry encourages deep breathing, which can help open up the airway at the bottom of your lungs and keep the gas exchange going good, to prevent, the alveoli from slapping shut. And it can also help with productive cough. Now, sometimes we want to ask the one question, rule them all about the answer choices too. For example, with this, what do I need to know in order to be able to make a decision about this answer option? I need to know what incentive spirometry is. So if I didn't know that, I would have a hard time deciding if this answer choice was a good one or not, and if I should say true or false. The other thing that I might need to know is what's the normal nursing skill for being able to do incentive spirometry? Like, does it even go every hour or not? And in this case, let's pretend like I didn't know what incentive spirometry was. This is how I'm just going to model for you what we do. I would say, I'd go to Google, say, what is incentive spirometry? Okay, it's not rocket science, what I teach. And you can look, the AI overview is often there in Google, and it can tell us what it is. It's to encourage deep breathing. And so we know like that right there is probably enough to let us know it's probably going to be helpful with pneumonia, but then we can also skim around it. I do recommend skimming through some of the other answer choices just to make sure that they line up with the AI, because AI is not always right, okay? Now, the other thing we need to know, though, is every hour, is that too much? Is that too little? How often should you be doing it? So let's say it. Let's say, how often should we do incentive spirometry? And right here we see, down here, it says you should use your incentive spirometer at least 10 times every hour. So that is almost a little misleading. So you got to read it a little bit more, because it does say you should use it every 1 to 2 hours while awake. And you should repeat the process at least 10 times. So when they say 10 times, they don't mean like do it every 6 minutes. They mean take a time once per hour and then blow into it 10 times. Okay. So this one sounds like a true answer. So we would select 1. Number 2, position the client in semi-Fowler's position. That helps improve oxygenation. This is almost always going to be a correct answer when it comes to improving oxygenation because it helps you sit up. So it takes gravity off your chest. Administer prescribed bronchodilators as needed. Again, if you don't know what bronchodilators are, Google it. What do bronchodilators do? And what that'll tell you is that it relaxes the airway, so it opens it up, and that's going to make it easier to breathe. So that sounds like that would be a good answer choice as well. So far I like 1, 2, and 3. I'm marking them all true. Number 4, limit fluid intake to prevent pulmonary edema. Okay, so this one sounds kind of scary because we're like, ooh, pulmonary edema. Yep, we don't want pulmonary edema. That means too much water in the lungs. So let's limit fluid to intake pulmonary edema. However, we have to remember to be comparing it to our internal concept map that we built when we looked at the question. And what we would know is like pulmonary edema is not something we expect to happen with community-acquired pneumonia, okay? So in fact, we actually want to stay hydrated because we have so much mucus with the pneumonia that if we get dehydrated, that mucus can really clog the airways more. Whereas if it stays moist and wet, we can cough it up really nicely. So I do not like number 4. I'm going to say false. And then number 5 is encourage deep breathing and coughing exercises. This is a great one because, again, it's just another way, kind of like the incentive spirometer, to get those alveoli open, keep the airways open, getting the mucus up and out so that we can breathe more clearly. So I like that one. Now, apply continuous positive airway pressure, CPAP. So this one, I'm like, ooh, no, I don't think so because it's only community acquired. It doesn't seem like it would be that severe that we would constantly need it. But if I'm not sure, I say, do we use CPAP for pneumonia? Okay, this is not a test. This is practice. We're learning and we're practicing things and we're getting more information and we're learning to think about it. That's how we need to approach these practice questions when we're studying. And so it says, yes, it can be used to treat pneumonia. Let's see. It can be. And it's saying also, people with CPAP are at higher risk for pneumonia. I'm thinking that it can be used for pneumonia, but probably more for severe cases. And this is not expected to be a severe case. I'm not going to pick 6 for CPAP. I put those answer options in, 1, 2, 3, and 5, and ended up getting them correct. So if you want to pause and read I'll zoom out a little bit, read the rationales a little bit, you can do that. Ooh, sorry. Yep, there we go. You can pause and read those rationales. But other than that, if you guys want me to do more NCLEX practice questions, just let me know in the comments what topics you'd like to see me do them on, and I'd be happy to do more. In the meantime, if you want to learn how to study this way yourself with practice questions, then head on over to this video, and I will see you there.